When you're dealing with advanced chronic kidney disease, there's this one huge decision that looms over everything. When is the right time to start dialysis? Today, we're going to unpack the actual clinical algorithm that doctors use to help make that life-changing call.
You know, getting a diagnosis like this, it's not the end of the road. It's really the beginning of a super important conversation between a doctor and their patient. It's all about balancing the hard data from lab tests with, how a person is actually feeling day to day.
And that really is the million-dollar question, right? It sounds so simple, but the answer is definitely not just waiting for some magic number to pop up on a lab report. No, it's about following a really structured path. So let's walk through that path together.
Okay, so first, a super quick refresher. What is chronic kidney disease, or CKD? Well, think of your kidneys as this amazing, high-tech filtration system for your body. With CKD, that system starts getting damaged and can't clean your blood properly. When that happens, waste products can build up and become toxic, and that's why getting the timing right on these big decisions is just absolutely crucial.
So here's probably the biggest myth we need to bust right now. The idea that one single lab result automatically means, boom, time for dialysis. That's just not how it works at all. Instead of some simple trigger, doctors use this really detailed algorithm that looks at a whole bunch of different factors. And here it is, this flowchart. This is the clinical roadmap that kidney specialists, nephrologists, use to figure out this super complex decision. Now, I know it looks a little intimidating at first glance, but don't worry. We're going to break it all down piece by piece, starting right at the top. All right, so our journey down this map starts with our first path, which is all about a number called the eGFR. That stands for Estimated Glomerular Filtration Rate. The easiest way to think about it is like a percentage grade for how well your kidneys are filtering. The higher the number, the better they're doing their job. So check this out. If a patient's eGFR is above 15, the path on our roadmap is pretty straightforward. No dialysis. And you might be wondering why. Well, it's because even though kidney function isn't perfect, most symptoms at this stage can be managed with things like medication. The whole game plan here is to protect the kidney function you've got left and just keep a really close eye on everything.
Okay, now we're getting to the tricky part. This is the real crossroads of the algorithm. This is that gray area where the decisions get a lot more complex, and you have to start weighing the hard data against how the patient is actually feeling.
Right. So when that eGFR number falls between 5 and 15, you'll see the algorithm splits into different paths. It all depends on the specific signs and symptoms the person is showing, and this leads us to a really important distinction between two types of reasons for starting dialysis.
This is super interesting. The algorithm basically separates the stop everything, start dialysis now situations from the okay, let's talk about this situations. So on one side, you've got absolute indications. Think of these as 5 alarm fires. We're talking life-threatening emergencies like dangerous inflammation around the heart or confusion because of toxin buildup. If any of those are happening, it's a non-negotiable. Dialysis starts right away. But then on the other side, you have relative indications. These are still really serious things, like constant fluid buildup or just being completely wiped out with fatigue, but they're not immediate emergencies. These are the ones that really need a deeper look and a careful conversation.
And that brings us to the final stage on our map, the last branch of the algorithm. This is when we're talking about the most advanced stage of chronic kidney disease. At this point, kidney function is, well, it's critically low, and the need to do something becomes way more urgent.
Yeah, so with an eGFR that's dropped below 5, the path actually becomes pretty clear again. The algorithm points straight towards starting dialysis. And that's because, honestly, almost everyone at this stage is feeling pretty sick and having major symptoms that just have to be dealt with.
But wait, what if someone has a number that low, but they say they feel okay? It's rare, but it happens. And this is a really key point. Even if that person feels fine, the recommendation is still to start dialysis. Why? Because on the inside, with kidney function that low, the body's chemistry is on a knife's edge. It's just too unstable. The risk of something catastrophic happening out of the blue, like a major heart problem, is just way too high to take that chance.
So, okay, we've got this nice, neat flowchart, right? It seems so logical. But here's the thing. Medicine doesn't happen in a textbook or on a flowchart. This is where a doctor's actual judgment becomes so important. You have to remember, the algorithm is a guide. It's not a set of ironclad rules. And this quote really nails the biggest challenge, the symptoms of kidney failure. The very things we're told to look for in the algorithm are super vague. I mean, think about it. Feeling tired, not feeling hungry, that could be a sign of kidney failure, sure, but it could also be caused by like 50 other things. And figuring that puzzle out, well, that's where the real art of medicine comes into play.
And that's the dilemma for the doctor, isn't it? Is this crushing fatigue coming from the kidneys failing, or is it something else entirely? Could it be depression, just bad sleep, a side effect from a different medication? This is where a doctor has to be a bit of a detective, ruling things out to make sure they're actually treating the right problem. You just can't replace that kind of experience.
So let's boil it all down. What are the big takeaways here? First, this decision is a process, not just a number on a chart. It's a true balancing act between lab results and how a person is actually living and feeling. It's about knowing when to hit the go button immediately for those absolute emergencies and when to pause and investigate for the relative ones. And really, the ultimate goal is to only start this incredibly demanding therapy when the benefits are absolutely clearly going to outweigh the burdens.
And that leaves us with one last big question to think about. This whole process, it really shines a light on this core tension in medicine today. As we get better and better data and our algorithms get more and more precise, how do we balance that against something you can't measure? Something like the simple, subjective, but incredibly important experience of how a patient truly feels. It makes you wonder, where does that perfect balance lie?